So for this episode, I'm covering strength training. But before we really get into the details of training strength, we need to be training the movement. So what we need to do is make sure we have the foot position right, the foot strength right, our body position right, and the movement. Because what we do not want to do, if there is a dysfunction, we don't want to be adding any strength to this, because what that is actually increasing the risk of injury. So what I'm going to do today is, it carries on nicely from the episode that I did on the foot. And this is just going into more where our weight is over the foot and then going into the movement. And I'm going to be explaining what an athletic hip hinge is. So this is what I'm going to be teaching today, is the athletic hip hinge. So the hip hinge carries over to almost every sport. In fact, even rowers, it has a huge benefit. And there's actually been some research shown on swimmers using the kettlebell, their times in the pool improved, and it's what's known as the what the hell effect. There is also some research with Dr. Craig Marker and the University of Padua that was used, so university in Italy, on ballet dancers that used the kettlebell. You had your control group that trained as they always had done, doing jumps and plyometrics and just trying to get higher on the jumps. And the other group that used the kettlebell. The improvement in the accuracy of the jump and the power of the jump was significantly better with the kettlebell. But before you move on to the kettlebell, you need to make sure that your hip hinge is optimal. Okay, so I'm going to explain to you, first of all, what a hip hinge is, an athletic hip hinge. Okay, so an athletic hip hinge, before I teach you how to get onto it, is that. Okay, we have rules within the athletic hip hinge. So the knees will move slightly forward, but they're not moving forward that we're squatting. We have hips above knees, shoulders above hips. Now, people, depending on what their structure is, what their levers are, will all look a little bit different. So don't panic if yours doesn't look the same as mine. I have very long levers, so it will look very different. Now, that's an athletic hip hinge, which is a sporting movement, because ultimately on a run, I'm in a variation of a hip hinge. Okay, so that is the importance of why this carries over to running. So a pure hip hinge, and you may have seen it in a different type of kettlebell lifting or with the barbell, is actually that. So it's still a hip hinge, but it's more pure hip hinge. Okay, that is not really going to benefit your running. So for this, we don't really want. So to get your hip hinge position, because some people actually struggle getting into that, again, if there's any imbalances and years of not actually strength training correctly, it can be very challenging. So what we want to look at is I think of it just doing a forward static jump. Now, if you've got any pelvic floor issues, please don't do this. Okay, I just want you to imagine that you're going to jump. And what you're going to do is, if you're going to jump forward, so I've got my feet set, okay, and I just jump. And where my feet land, so I'll do it forward for the camera, I've taken my hips back, and that's where my distance is for me, because my feet have landed where I want, where is appropriate for me. If you have pelvic floor issues and you do not feel comfortable doing a forward jump, another rule you can use is the crease of the shoulder here, have the inside of the heel level here. That tends to work for most people. There may be outliers, okay, there always is, but for, I would say 90–95% of the people, this is appropriate. So what we tend to have when we say to ladies, stand hip width, they all go like this. You say to guys, shoulder width, they all do this too. So there's a reason I tend to prefer a little bit more precision. It's my OCD thing. So what I'm going to have done is my feet are pointing forward. Okay. They don't, because of our hip structure. Again, without scanning your hips, I do not know what's going on with them. So what I tend to say to people is rock back onto the heels, squeeze your butt, and imagine you just corkscrewing the heels together. And you will see that my feet are slightly turned out. And I'm not going to go into all the anatomy and physiology, and there's some people that are purists of the feet go forward. Please don't, because it can jam up the hip. This is just an accurate way of seeing where your feet go and where your hip structure is. Now, you may notice that my feet, for those beady eyes of you, that my right foot slightly turns out more. For the point of this exercise, I'm going to match that left foot, okay? Don't need to know all the wheres and whys, and that's for the anatomy and physiology lesson. So what I'm going to do now, for some of you, if you're looking down at your feet, you may find that your arches are collapsing, okay, or your feet are flat. So what we're going to do from here is I want you to pull your toes up. So you're going to stand nice and tall. Everything's going to be stacked. I'm going to pull my toes up, okay, and you can see that my arches have lifted. And then maintaining that arch, all I'm going to do is lightly press my toes into the floor. And I just want you to observe, even if you close your eyes, and feel where your weight is. And we're trying to maintain the arch of the foot, okay? And you may find that your glutes have come in a little bit more and you're standing a little bit taller, okay? That is the foot position that you want. So if you look down, take a photo of where you are, and that is your position today. So often as people progress and people work with me, we may change their foot stance, their foot position as their mobility and their strength changes. But today that is where it's going to be. So take a note of it. So I've done a few thousand of these, so I don't really need to look at it. I know where I am. So from there, I've got my weight over me. I've got my strong, this is what I call a strong foot. My toes remain in contact with the floor. So just there, just relax your big toe a little bit, okay? Just feel what's going on here. And then I want you to press your big toes into the floor. And you should feel this tighten a little bit, okay? It may take you a little bit to get the feeling, but this is really, really important, okay? So I'm just looking straight ahead, my head's on top of my body, everything's nicely stacked. So that is going to be your upright position. Now, what we want to do is we're going to hinge back. So what I want to do, I'm going to put my hands on my thighs. I'm going to think about, as I stick my butt back, so a hip hinge, I'm going to anti-shrug my shoulders. So you can see there, I'm anti-shrugging, I'm pushing my hips back, and I'm pushing the hips back. And as soon as my hips have stopped moving, that is as far as I need to go. Okay, and then from there, I just stand up. So facing you, I've got my foot set up, got my hands on my thighs, I'm anti-shrug. I'm looking 2 meters to the floor. I'm pushing my hips back, my toes stay on the ground, and I push back. Now, if you notice here, as I'm hinging back, I'm opening my hips and I'm slightly opening my knees. So if you've watched the other episode, remember what I said, what the knees do, what the hips tell them. So think, make space in the hips. My torso is going back between my femurs, okay? And my toes stay in contact and my knees are here. I'm not doing this. So I'm getting out of my own way. I'm going to show you if I hinge on top of my femurs, and I want you to watch what's going on here. So got my stance, and I'm not going to get out my own way. I'm going to hinge on top of my femurs. So hinge back, and that's kind of an ugly back. It is not an optimal position. And then if you watch here, my knees are rolling in. My knees will get very, very grumpy. And what we want is our strength training to complement our running, which is that sort of movement. A hip hinge, okay? So that's where we need to be strengthening. The best movement that you can do that you do not need a gym for is the hip hinge. And all you need is the humble kettlebell. It's easy. This is a 16 kilo, and do not underestimate what benefit this will give you. To be honest, you don't want to be any lighter than a 12 for women for a kettlebell deadlift or swing. Anything lighter is too light. You need to feel how the body is moving. So we've looked at the setup, we've looked at the hip hinge. What you should be feeling at this point here is the hamstrings, okay, which is your posterior chain, which is going to strengthen you to go that way, okay? That's the position. So then we need to look at where the head's going. So what I'm not doing is hyperextending the neck, because look what happens to my back. This directly has correlation to what is going on your lower back. Your neck's not going to like you, and it's going to get very grumpy very quickly. Likewise, we do that, and then I get an ugly lower back and I start to round here. We don't want that. So ideally, think credit card lengthways under the chin. You can have a slight extension. What we don't want to be doing is jamming the neck up. So I would always say, look, a couple of meters in front of you, open the knees, open the hips, anti-shrug to there. And just get used to that feeling. Do a few of those. Keep the weight on over the feet, of not allowing the arches to roll in, and keeping the toes down. The reason being that the toes need to be on the floor is you are more stable, it is safe, and the midsection starts to work. So strength training is a great benefit, but it's how you do it. And I would always advise somebody to go to an experienced coach. And it's absolute must. Kettlebells are a fabulous tool used right. Used incorrectly and with an inexperienced coach, they can be not the best tool. Okay, I teach online, and I've got people through an awful lot of certifications of learning how to use the kettlebell for a world-renowned company, and it's not an easy certification. Now we need to discover where our upright is. And again, don't underestimate the power of where you are when you're upright. So when I actually ask people to say, can you hit upright for me? And I go, or stand to attention, they tend to do this. That is not where we want to be. Okay, so the way you can do it is you can stand in your setup position. Remember, photo where your feet are. I've got my hips against the wall. I've got my shoulders against the wall. Now, if you struggle getting your bony part of your skull here, the occiput, against the wall, don't jam the neck up there. I would prefer you to have your butt against the wall, your shoulders against the wall, and if you can't get the head against the wall, just keep the neck relaxed. I do not want any tension in there. Now, in this position, what I want you to think about is pushing your feet through the floor. Imagine that you are stood on wet sand and you want to make really deep footprints. I know it sounds weird, okay, but this is going to make you strong in the upright position. So feet through the floor, pull your kneecaps up, okay, so these are tight, okay, squeeze your butt, okay, so those glutes, your big peach, squeeze it, okay. If I gave you a £50 note, I cannot pull it back. From there, I'm reaching my fingers down to my ankles and I'm really pulling down. And then just give yourself a bit of a slap here. So this is what we call an ab brace. So it's anti-shrug, and I want you to think about the crown of the head to the ceiling. So do a mental check. This shouldn't be easy. I don't want it easy. Your comfort is not my concern. It needs to be hard to make you strong and make you efficient. So at this position, so this is what I call hard style standing. So feet through the floor, pull the kneecaps up, squeeze the glutes, brace the abs, anti-shrug, reach your middle fingers down to your ankles. So you should be feeling these big muscles here, your lats, and you should be feeling the back of the arms, the triceps, and you should be nice and tall. Okay, now if you're not sure if you're feeling your glutes, so your big peach muscles, these are the power muscles of the body. These are your engine drivers. What I want you to think about is corkscrew. You're not going to, but I want you to imagine that you're corkscrewing. So I'm going to exaggerate it for the video. I'm corkscrewing my feet in. Okay, just feel that. So feet through the floor, kneecaps, squeeze the glutes, corkscrew. These come online even more. So that's where you need to be. So that's really important. So next thing we need to do, I know this is a lot of information, but do this when you're loading your dishwasher or hinging back. Just practice it when you're cleaning your teeth. It will be so, so valuable. Okay, when you get people saying, oh, back when I dropped the sock, no, the sock on the floor, there was already an underlying injury there anyway. Okay. And so what we want to do is, if you can stand with the kettlebell between the heels. You've got the kettlebell between the heels. And you're going to stand over the kettlebell. You're going to brace the abs. And you're going to open and reach down. So I've got that anti-shrug. Open the knees, open the hips, reach, and then stand tall. So another point when you're actually going to hip hinge is put your thumbs on your lower ribs and your middle fingers on the top of the hip. So what we're actually doing is, as we push the hip back, we keep that connection. So what's not happening is we're not arching the back. So what we're not doing is that, and the thumbs and the fingers are moving further away, which then you're going to be overusing your lower back. And we're not going into what I call an ugly back. Okay, so what we're doing is opening the hips. We've got that connection. It's there, and then you're going to reach down. Okay, and then you stand to attention. So this time you're going to anti-shrug. So think long arms. You're going to open the knees, open the hips. Think about the strong foot. Reach. Get hold of the handle of the kettlebell or even just the hinge. And then you're going to keep hold, stand to attention. And then you The kettlebell goes back exactly to where you picked it up from. Okay. That is basically what a hip hinge or a kettlebell deadlift is. And even if you're using a barbell, it's still the same movement. I will always start somebody off on the kettlebell as it's the safest way of learning to do the movement. But body weight is learn to control your body weight first. It is so important. So from the front, I'm going to go over the position. Get your foot set up, strong foot, press the toes into the floor, maintain that move. Open the hips, open the knees, anti-shrug, long arms, stand to attention. So you can do breathe into the belly. Again, I will do another video on breathing. Breathe into the belly. Side on, that kettlebell is almost traveling in a straight line. So I've got the post-it back between the ankles or between the heels. Okay, so that is the movement. What you don't want, the kettlebell moving back, because can you see my hips are starting to move up? My hips are starting to move up, then my lower back is vulnerable. I would always, even many of my more advanced students, I often regress back to the kettlebell. The reason I like the kettlebell swing is purely because with the kettlebell swing, it is a safe way of doing a really powerful, explosive movement. So I was part of, there's a study out there from the University of Chichester with a Dr. Jason Lake. And it was on the kettlebell swing. I can't remember the name of the study. It's many years ago. And I was part of that study, and I was using a 24 kilo kettlebell. And it was a few years ago. My kettlebell swings were not as powerful as what they are now. And I do more the athletic hip hinge. The movement I was doing there was some sort of hybrid, whatever, you know, like I say, it's a long time ago. So what I'm going to do is demonstrate an athletic, powerful swing. On the study, I was putting, I think, 180 kilos of downforce through the floor. I cannot deadlift on a bar 180 kilos. My one rep maximum is 120 kilos. Okay, so if I can do that sort of power generation with a kettlebell safely, and then that's what I want to do. And I'm going to show you what a kettlebell swing should look like, and then I'm going to explain the benefits of it. So my setup, again, I'm not going to teach the swing today because it's a complex move. Please, if you are going to learn the swing, learn it with an instructor who knows what they're doing, preferably a strong first instructor. There may be some RKCs in this country as well, but those are what we need. Is I want you to be a powerful, robust, resilient athlete, and you are never too young to learn. So from here, this is what a kettlebell swing should look like. Okay. So what's actually happening? The force that I'm doing is going through the floor. 33 point something % of the force is going that way. Nothing is actually happening in these arms. I am not lifting these arms. What's happening is the power from my engine drivers, the big gluteus maximus, is going and transferring the kettlebell power that way. You do sets of 10 good, powerful swings. I will promise you Once you've learned the movement, the carryover to your training will be huge, and it's not putting your joints at risk. It is just going to make you a powerful, resilient athlete, which is what we all want. So the next part that I'm going to move on to, which I'm going to do a separate video, and I'm going to explain now why I'm going to do it, is the single leg deadlift. So the single leg deadlift is basically the two-legged deadlift on one leg. So only two-leg deadlift. The reason I do not move people straight onto lunges is the lunge is a complex movement. Okay, it is butchered no end of times. If your alignment has not been assessed, your hip structure and your movement has not been assessed, you are also putting yourself at risk of an injury. So seeing people doing in gyms one leg deadlifts, if it's appropriate and you are a functional athlete, knock yourself out, do it. But a walking lunge should be here, and you can see that my hips are level, my shoulders are level, my knee isn't collapsing in, my foot from the side, my foot has maintained its arch, my knee isn't there, and my abs are there. Okay. But doing walking lunges under load, if you are not stable, you are training a dysfunction. So with the single leg deadlift, I will cover, and I've got regressions and I've got progressions. Once you've mastered the two leg, you can do a good swing. I'm going to show you how to do a functional one leg deadlift.